Question number 1.
Nurse Mimi is taking care of a patient diagnosed with pyelonephritis. Which of the following symptoms would Nurse Mimi expect to verbalize for a patient with pyelonephritis? A. Burning sensation on urination. B. Jaundice and flank pain. C. Costovertebral angle tenderness and chills. D. Polyuria and nocturia. The correct answer is letter C, costovertebral angle tenderness and chills. Acute pyelonephritis is a bacterial infection causing inflammation of the kidneys. Therefore, pain will be prominent at the costovertebral angle, located on either side of the human back, between the 12th rib and the vertebral column where the kidney lies directly below this area.
Question number 2.
Christian, a male client with acute pyelonephritis, receives a prescription for cotrimoxazole, Septra, PO twice daily for 7 days, which finding best demonstrates that the client has followed the prescribed regimen. A. Flank and abdominal pain decreased. B. Urine output increases to 1,500 milliliters per day. C. Bacteria are absent on urine culture. D. The red blood cell RBC count is normal. The correct answer is letter C. Bacteria are absent on urine culture. Cotrimoxazole is a sulfonamide antibiotic used to treat urinary tract infections. Therefore, the absence of bacteria on urine culture indicates that the drug has achieved its desired effect.
Question number 3.
David returns to the nursing unit following a pyelolithotomy for removal of a kidney stone. A Penrose drain has been placed. Which of the following would the nurse include in the postoperative care for clients with Penrose drain? A. Weighing the dressings. B. Frequent dressing changes around the Penrose drain. C. Sterile irrigation of the Penrose drain. D. Maintaining the client's position on the affected side. The correct answer is letter B. Frequent dressing changes around the Penrose drain. A Penrose drain is a soft, flat, flexible tube made of latex. It lets blood and other fluids move out of the area of your surgery. Frequent dressing changes around the Penrose drain is required to protect the skin against breakdown from urinary drainage.
Question number 4.
Nurse Mimi is providing teaching to a group of students regarding renal failure. She asked the students which of the following clients is at greatest risk for developing acute renal failure. From the given choices below, they are correct if they answered. A. A person who undergone appendectomy. B. A teenage client who gets influenza. C. A pregnant woman who has a fractured femur. D. A client with diabetes who has a heart catheterization. The correct answer is letter D. A client with diabetes who has a heart catheterization. Clients with diabetes are prone to renal insufficiency and renal failure. Here is a picture of a blood vessel of a non-diabetic versus diabetic patient. A diabetic person has a more viscous blood, making the flow of the microfilters difficult, giving it pressure and saturation. In long-term effect, those microfilters are damaged, leading to renal failure.
Question number 5.
Nurse Mimi is planning teaching strategies for Brian with chronic renal failure. She must keep in mind the neurologic impact of uremia. Which teaching strategy would be most appropriate? A. Providing all needed teaching in one extended session. B. Validating frequently the client's understanding of the material. C. Conducting a one-on-one session with the client. D. Using videotapes to reinforce the material as needed. The correct answer is letter B. validating frequently the client's understanding of the material. When the kidneys are unable to filter urea and other waste products from the body efficiently, these waste gets into the brain. This causes decrease in attention span, irritability, and progress to altered personality or inability to assimilate information and participate in care. Awareness of changes provides opportunity for evaluation if the patient really understood the discussion.
Question number 6.
Upon receiving laboratory results of Brian, who was diagnosed with renal failure, his blood calcium levels are below normal. Nurse Mimi would expect that the client may experience A. Headache, B. Serum calcium level of 5 milliequivalents per liter, C. Increased blood coagulation, D. Diarrhea. Let's apply the process of elimination. Headache doesn't have any direct association to low calcium levels. Therefore, letter A is incorrect. The normal calcium levels averages between 4.3 to 5.2 milliequivalents per liter. Therefore, 5 milliequivalents per liter is within normal range, making option B incorrect. Always remember, calcium stands for coagulation and contraction. Therefore, if there is an increase in calcium, there is increase in coagulation and smooth muscle contraction, making option C incorrect. Low in calcium makes our smooth muscles unable to contract. Therefore, intestines relaxes, leading to diarrhea, which makes option D a correct statement. Therefore, the correct answer is letter D.
Question number 7.
Nurse Mimi assesses Brian, who has chronic renal failure, and notes the following: elevated blood pressure, crackles upon lung auscultation, and weight gain of 2 pounds in 1 day. Based on these data, which of the following nursing diagnosis is appropriate? A. Excess fluid volume related to the kidney's inability to maintain fluid balance. B. Increased cardiac output related to fluid overload. C. Ineffective tissue perfusion related to interrupted arterial blood flow. D. Ineffective therapeutic regimen management related to lack of knowledge about therapy. The correct answer is letter A. Excess fluid volume related to the kidney's inability to maintain fluid balance. If you have acute kidney failure, you may have generalized swelling due to fluid retention since your kidney is unable to release fluids properly. Using a stethoscope, your doctor may hear crackling in the lungs. These sounds can signal fluid retention. Other symptoms include weight gain, elevated blood pressure are indicators of excess fluid volume.
Question number 8.
Brian, with chronic renal failure, tells Nurse Mimi that he takes magnesium hydroxide, milk of magnesia, at home for constipation. Nurse Mimi suggests that he should switch to psyllium hydrophilic muciloid metamucil because A. Milk of magnesia can cause magnesium toxicity. B. Milk of magnesia is too harsh on the bowel. C. Metamucil is more palatable. D. Milk of magnesia is high in sodium. The correct answer is letter A. Milk of magnesia can cause magnesium toxicity. Magnesium is normally excreted by the kidneys. When the kidneys fail, the kidney has a vital role in magnesium homeostasis. Magnesium can accumulate and cause severe neurologic problems.
Question number 9.
Brian, with acute renal failure, has a serum potassium level of 5.8 milliequivalents per liter. Which of the following is the most important nursing priority action? A. Encourage increased fluid intake around 500 milliliters to dilute potassium level. B. Encourage increased vegetables in the diet. C. Place the client on a cardiac monitor. D. Check the sodium level. The correct answer is letter C. Place the client on a cardiac monitor. Potassium plays a vital role in cardiac muscle contractions. The normal serum potassium level ranges from 3.5 to 5.2 milliequivalents per liter. Therefore, clients with hyperkalemia is at risk for developing cardiac dysrhythmias and cardiac arrest. Because of this, the client should be placed on a cardiac monitor. Changes in electromechanical function may become evident in response to progressing renal failure and electrolyte imbalance.
Question number 10.
Brian, who was diagnosed with chronic renal failure, was prescribed with aluminum hydroxide gel, Amphigel, to take at home. She asked Nurse Mimi what is the purpose of giving this drug to a client with chronic renal failure. A. To prevent curling stress ulcers. B. To relieve the pain of gastric hyperacidity. C. To bind phosphorus in the intestine. D. To reverse metabolic acidosis. The correct answer is letter C, to bind phosphorus in the intestine. Here is an illustration of calcium and phosphorus in the bloodstream. They are inversely proportional to each other, which means that if there is an increased level of calcium in the blood, the more phosphorus is excreted in the kidney. During kidney failure, phosphorus are not excreted properly, therefore it clumps up, causing a decrease in serum calcium levels. This leads to bleeding disorders as calcium is involved in coagulation, osteopenia or loss of bone mass density, and cardiac dysrhythmias since calcium plays an important role in smooth muscle contraction. As part of preventive measures, medical practitioners administer aluminum hydroxide, which binds the phosphorus in the intestine and is excreted in the bowel. This brings back normal serum calcium level in the blood.
How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.